TFD. That means that genus of tick is acting as a vector here. Haemophysalis, even the Rhipicephalus or Buphalus in the olden days, which is renamed as Rhipicephalus, it helps in the transmission of the disease. So important. So usually Theileria orientalis cause a benign sort of infection, benign or non-transforming sort of theileriosis in cattle and buffaloes. Recently, fatal outbreaks have been reported where there is hemolytic anemia will be there, abortion. This is a point you have to emphasize. Abortion and the death of animal if it is not treated in time. Even India also it is reported. Lately, nowadays, recently 2-3 years, it is having a surge of infection reported from cattle in India. So Theileria orientalis infection characterized by the following clinical signs like fever, anorexia, lacrimation will be there. There is a depression and the nasal discharge is also possibility is there. There will be elevated heart rate, then abnormal breathing, a sort of abdominal breathing will be there, pale mucous membrane because of anemia, jaundice, and then abortion in the pregnant animal. This is also accountable. We'll tell the short story. Recently, myself and Bhatt went to one of the farm in Thalya nearby Odalkere in Chitradurga district, where they have a good number of animals. So two animals they aborted when we went there. The doctor has treated with buparvacan already. One the non-pregnant animal was also having the similar condition where the fever was not getting reducing even after 3-4 days of treatment. So accidentally we took blood and the serum we have sent it for Nivedi where we are confirmed with Theileria orientalis because we doubted because the aborted animals it was in the 3rd semester. We have we have tested for brucella after coming to the college. It was negative for brucella. So accidentally we sent for some other purpose. We detected a high incidence of this Theileria orientalis in that animal, which was not treated with buparvacan. So on that day, we have given, thinking that it may be theileriosis, we have given the dosing. Now the animal is okay, but the thing is that it is going unnoticed nowadays. Abortion, not only that we can think in brucella. Not only we can in the early stage we can not only we have to think for trichomonas where there will be abortion in the first trimester. So you have to look for the midterm abortion also where it can be accounted for Neospora caninum in cattle. So trypanosomosis is one more disease condition. This sir.
The Theileria orientalis is an emerging disease. So the thing is, it is sometimes it will never respond to even buparvacan.
Buparvacan also it is missing. They said in Bangalore they have tried even for buparvacan also it is not responding.
Yeah, that's one of the alarming thing.
And then even in the USDA, that they also not come up with any of the treatment regime for this as of now. Recently, 2022 article I was referring yesterday, that it is not a proper treatment is not, they have not scheduled as such as far as this Theileria orientalis. Sir? Temperature, other temperature itto. Lacrimation, nasal discharge, but problem under our name poisoning on the Karsidra actually. Poisoning under Adagi, Ipodis Ago, animal element normal sick bandide, but poisoning agi recover agide. Now angle anta our angondo other ella treatment ಮಾಡ್ಬಿಟ್ಟಿದ್ರು but ಈ ಬ್ಲಡ್ ಮತ್ತು ಸೀರಮ್ ತಗೊಂಡು ಅಲ್ಲಿ ಕಳಿಸಿದಾಗ ಯಾಕಂದ್ರೆ ಬ್ಲಡ್ ಸ್ಮಿಯರ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಅಲ್ಲಿ ನೆಗೆಟಿವ್ ಬಂದಿದ್ದು PCR ಲೇ ಪಾಸಿಟಿವ್ ಬಂದಿರೋದು ಯಾಕಂದ್ರೆ OTC ಹೊಡೆದಿರೋದ್ರಿಂದ ಥೈಲೇರಿಯಾ ಅಗೇನ್ ಕಷ್ಟ OTC ಹೊಡೆದು ಕಳಿಸ್ಬಿಟ್ರೆ ನಮಗೆ ಬ್ಲಡ್ ಭಾಳ ಕಷ್ಟ ಭಾಳ ಸತಿ ಹೆಂಗೆ ಆಗ್ತಾ ಇದೆ ಅನಿಮಲ್ ಪೋಸ್ಟ್ ಮಾರ್ಟಮ್ ಮಾಡ್ತಾರೆ ಅಬೊಮೆಜರ್ ಅಲ್ಸರ್ ಇರುತ್ತೆ ನಮಗೆ ಬೈತಿರೋದು ಇಟ್ಸ್ ಕ್ವೈಟ್ ಕಾಮನ್ ಅಕೌನ್ಸ್ಟಮ್ ದಟ್ ಬಿಕಾಸ್ ಯಾಕಂದರೆ OTC ಕೊಟ್ಟ ಮೇಲೆ ಆರ್ಗನಿಸಮ್ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋದು ಕಷ್ಟ ಬ್ಲಡ್ ಸ್ಮಿಯರ್ ಎಕ್ಸಾಮಿನೇಷನಲ್ಲಿ ಸ್ವಲ್ಪ ಕಷ್ಟ ಬೊಪಾರಕೊಂಡು ನಾವು ಅವತ್ತು ಹೋದಾಗ ಕೊಟ್ಟಿದ್ವಿ ಅವರು ಎರಡಕ್ಕೂ ಕೊಟ್ಟಿದ್ರು 2 ಅಬಾರ್ಷನ್ ಆಗಿತ್ತಲ್ಲ ಅದಕ್ಕೆ ಹೇಳಿ ಕೊಟ್ಬಿಟ್ಟಿದ್ರು ಆಲ್ರೆಡಿ ಅವರು ಬೊಪಾರಕೊಂಡು ಸಮ್ಟೈಮ್ಸ್ ದೇ ಸೇ
recently emerging. See, we have got that Vasanagar also. We have got some of these symptoms very similar to that of the same thing.
Okay, sir. Was there any abortion, sir?
And 2 deaths were there.
Okay, death. Okay, right. So trypanosoma, it is one of the common diseases which go unnoticed. Otis. You get No, no, need not be. What I'm saying is, in
correlate with this one, sir.
you can send the blood or serum sample. Will definitely confirm within 2 days. Definitely. The reason why I'm telling this that ಈಗ ಯು ಪಿಲಿ ಅದು ಆಗಿದೆ ರಿಪೋರ್ಟ್ ಮಾಡಿದ್ದಾರೆ. ನಮ್ಮ ಸ್ಟೇಟಲ್ಲಿ ವಿ ವಾಂಟ್ ಟು ಹ್ಯಾವ್ ಎ ಸ್ಟಡಿ. ಯಾಕಂದರೆ ಬಿಕಾಸ್ ನೀವೇ ಅಲ್ಲಿ ಇರೋದ್ರಿಂದ ನಿಮಗೆ ಎಕ್ಸಾಕ್ಟ್ ಗೊತ್ತಾಗುತ್ತೆ. ನಾವು ಯಾರಿಗೋ ಫೋನ್ ಮಾಡಿ ಹೇಳೋದಕ್ಕಿಂತ ಇಂಥ ಕಾನ್ಫರೆನ್ಸ್ ಇಂಥ ಟ್ರೈನಿಂಗಲ್ಲಿ ಹೇಳ್ತಾ ಇದ್ದರೆ ಸ್ವಲ್ಪ ಈ ಆ್ಯಂಗಲ್ ಯೋಚನೆ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಷ್ಟೇ. ಡ್ರಗ್ ಆಫ್ ಚಾಯ್ಸ್ ಇಲ್ಲ. ಬೊಫಾರೋಕೋನ್ ಕೊಡ್ತಾ ಇದೀವಿ, ಇಲ್ಲ ಆಗ್ತಾ ಇದೆ. ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಅಲ್ಲಿ ಆಗ್ತಾ ಇಲ್ಲ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಅವ್ರು ಕನ್ಫರ್ಮ್ ಮಾಡಿ ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಬೊಫಾರೋಕೋನ್ ಆಗ್ತಾ ಇಲ್ಲ ಅಂತ. ಬಟ್ ನಾವಿಲ್ಲಿ ಬೊಫಾರೋಕೋನ್ ಕೊಟ್ಟು ಬಂದಿದ್ದೆ ಅವತ್ತು 3 ಅನಿಮಲ್ಲು ರಿಕವರಿ ಆಗಿದೆ. ಅದಕ್ಕೆ ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ಅಲ್ಲ ಅದು ಅದಿದೆ, ಅದು ಪೈರಾಕ್ಸಿ ಆಫ್ ಅನ್ನೋನ್ ಆರಿಜಿನ್ ಚಿಕನ್ ಸೇ ಅಬಾರ್ಷನ್ ಆದವೆಲ್ಲ ಇದೆ ಅಂತಲ್ಲ. ದೇರ್ ಇಸ್ ಎ ಪಾಸಿಬಿಲಿಟಿ. ನಾನು ಹೇಳ್ತಾ ಇರೋದು ಆ ಥರ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಷ್ಟೇ. ಈವನ್ ಕ್ಯಾಟ್ಲಲ್ಲೂ ಮಿಡ್ ಟರ್ಮಲ್ಲಿ ಆಯಿತು, ನಿಯಸ್ಪರ್ ಇರ್ಬೋದು. ಡಾಗ್ ಅಂತೂ ಕಾಮನ್ ಆಗಿ ಇದ್ದೇ ಇರುತ್ತೆ. ಯಾಕಂದರೆ ಯಾವುದೇ ದನ ಸಾಕಿದ್ರೆ ನಾಯಿ ಅಂತ ಇದ್ದೇ ಇರುತ್ತೆ. ಸೊ ಇನ್ ದಟ್ ಆ್ಯಂಗಲ್ ಯು ಹ್ಯಾವ್ ಟು ಓಪನ್ ಅಪ್. ದಟ್ಸ್ ವಾಟ್ ಐ ಮೀನ್. ಡೆಫಿನೆಟ್ಲಿ ನಿವೇದಿ ಕಳಿಸ್ರಾಯ್ತು ಅಥವಾ ನಮಗೆ ಮಾತಾಡಿದ್ರೆ ನಾನು ಡೈರೆಕ್ಟ್ ಮಾಡ್ತೀನಿ, ತೊಂದರೆ ಇಲ್ಲ.
ಸರ್ ಬೊಫಾರೋಕೋನ್ ಜೊತೆ
ಒ ಟಿ ಸಿ ಕೊಡ್ಬೋದು ಅಂತಾರೆ ಸರ್. ಯಾವ್ದು ಸರ್? ಬೊಫರ್ ಕೊಡ್ತಾ ಇದೆ ಸರ್, ಕೊಡ್ತಾ ಇದೆ.
30 to 40 ml
ಒ ಟಿ ಸಿ ಹಾಕೋದು ಮತ್ತೆ ಇನ್ನೊಂದು ಸತಿ ಹಾಕೋದು ತಪ್ಪುತ್ತೆ. ಅದು ಸರ್
oriantalis ಮಾತ್ರ 2 ಡೋಸ್ ಅಂತ ಹೇಳ್ತಾರೆ 48 hours ಅಲ್ಲಿ. ಬಟ್ ಕೋಇನ್ಸಿಡೆನ್ಸ್ ಆಗಿಬಿಡುತ್ತೆ ಅಬಾರ್ಷನ್ ಮತ್ತು ಬೊಫಾರೋಕೋನ್
ಇಂಜೆಕ್ಷನ್ ಆಗ್ತು ಅಂತಂದ್ರೆ ಅವ್ರು 2 ಕೊಟ್ಟಿದ್ದಲ್ಲ ಅಬಾರ್ಷನ್ ಆಗಿದ್ದು. ಬಟ್ ಶಿ ವಾಸ್ ಗುಡ್ ಆ್ಯಕ್ಚುಲಿ. ಶಿ ವಾಸ್ ಎ ಗುಡ್ ಓನರ್. ಅವ್ರ ಪಾಪ ಎಲ್ಲ ಕ್ಲಿಯರಾಗಿ ಎಲ್ಲ ಹೇಳಿದ್ರು, ಹಿಂಗೆ ಆಗಿತ್ತು ಅಂತ ಎಲ್ಲ ಹೇಳಿದ್ರು. ಅವ್ರೇನು ಅದಕ್ಕೇನು ಅಬಾರ್ಷನ್ ಆಗಿ ಬೇಜಾರು ಮಾಡ್ಕೊಳ್ಳಿಲ್ಲ. ಬಟ್ ನಾವೀಗ ಒಂದು ಫೈಂಡಿಂಗ್ ಒಂದು ಬೇಕಿತ್ತು, ಅದಕ್ಕೆ ಆ ಇಂಟೆನ್ಷನ್ಲಿ ಮಾಡಿದ್ದು ಅಷ್ಟೇ. ಸೊ ಟ್ರಿಪಾನೋಸೋಮ್ಸ್ I do got these cases when I was working in Vanali. So where there will be a nervous form will be there, where the animals will be eating against inanimate objects. Not only you have to think for leptospirosis, in this angle also you have to. Trypanosoma is one more condition where very specifically in dogs, corneal opacity will be there. Whenever trypanosoma is there, clear cut corneal opacity will be there. Whereas in case of large ruminants, there will be a more often the less, if it is an acute sort of infection, it is there will be a neurological symptoms where the animals will be eating against the mangers or inanimate objects. Very specifically, I encountered in 2 buffaloes. The single prick of Bernil has taken care of because I was not having Suraman at that time. So dimension Bernil also is having good result as far as this trypanosomosis is concerned. So management of tetanus, because it is again vector-borne diseases. In India, tetanus is the main vector, which is a robust fly, biggest fly what you can encounter around the animal premises. Tetanus is the major cause for transmission of trypanosoma infection. Then these 2 are of zoonotic importance, where traveler's diarrhea, Giardia lamblia, not of animal importance. Cryptosporia, again it is more of immunosuppressed individuals are at high risk. So in conclusion, I can say the economic losses as far as parasite are concerned often go unnoticed in a dairy sector. This is because most of the animals have parasite burden that are truly subclinical. The clinical signs will not be expressed till it gets overburdened with the parasite. Then these losses are often very insidious in nature and then often difficult to prove statistically in a consistent manner. Hence, there is a need to define the benefits related to parasitic control in cattle, at least, to develop a clear or the effective parasite control recommendations. This will allow the producer, the farmer, to realize these benefits and effectively transfer this infection to farmers. This is also equally important because parasitic diseases, the management, it is very important. So that's all from here. If you have any queries, you can.
ಮುಂಚೆಗಿಂತ ಏನು ಕಡಿಮೆ ಆಗಿದೆ ಅನ್ಸುತ್ತಲ್ಲ, ಅಲ್ಲ ಇನ್ ಜನರಲ್ ಪೋಸ್ಟ್ಮಾರ್ಟಮ್ ಮಾಡೋದಾಗಲಿ ಆಗಲಿ ಯಾವಾಗಲೇ ಆಗಲಿ.
ಎಸ್,
ನೋಡು ಫೇಶಿಯಲ್
ಡೆಫಿನೆಟ್ಲಿ ಅದೇ ಏನದು ನವಡೇಸ್ ನೀರೇ ಇಲ್ವಲ್ಲ ಕೆರೆಯಲ್ಲಿ ಕುಡ್ಸೋಕ್ಕೀಗ. ದಿಸ್ ಇಸ್ ವಾಟ್ ಇಸ್ ಬಿಕಾಸ್ ಓವರ್ ದಿ ಪೀರಿಯಡ್ ಆಫ್ ಟೈಮ್ ಈವನ್ ದಿ ಫಾರ್ಮರ್ಸ್ ಹ್ಯಾವ್ ಕಮ್ ಟು ನೋ ದಟ್ ಮೀನ್ಸ್. ಯಾಕಂದರೆ ಹಿಂದಂತೂ ಅದೊಂದೇ ಸೋರ್ಸ್ ಇತ್ತು. ಈಗೆಲ್ಲ ಮನೆ ಕಟ್ಕೋತಾರೆ, ಬೋರ್ ಹಾಕ್ಸ್ತಾರೆ. ಬೋರ್ವೆಲ್ ವಾಟರ್ ಇಫ್ ಯು ಗಿವ್ 100% ನೋ ಪ್ರಾಬ್ಲಮ್ ಅಟ್ ಆಲ್. No snail, no trematode. That's what even the contempt, clean pasture, clean drinking water, no parasite. Deworming, that is also equally. Even the farmers are coming and taking soon after birth. Don't ಮಾಡ್ತಾನೆ ಇದ್ದಾರೆ. Deworming is also is proper nowadays.
ಜಂತುನಾಶಕ ಭಾಳ
Even the government had also given one plan maybe in the 4-5 years back, that also accounted maybe, I don't know. Because when I was working, we used to get only few tablets. Now even the 1 liter ivermectin is available in the veterinary hospitals.